Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is considered as a fundamental part of general health, as it is a state of wellness that enables individuals to activate their abilities and potentials in order to deal and cope with different life conditions, work productively, and contribute effectively within the family and community. Therefore, mental disorders interfere with this state of wellness. Some examples of mental disorders are depression, anxiety, schizophrenia, obsessive-compulsive disorder, drugs and alcohol abuse, behavioral disorders, and suicide. These disorders represent a public health issue as they concern the entire population and are a large and a real problem in our communities. Currently, there are more than 450 million people suffering from mental health problems worldwide. 1 out of 4 individuals suffers from mental health problems at some point in life. 150 million people suffer from depression. 38 million suffer from epilepsy. More than 90 million suffer from alcohol and drug addiction. Every 40 seconds, one person in the world commits suicide. There is a strong association between physical and mental health. We find, for example, that individuals with chronic physical illnesses are more vulnerable to some mental disorders. The prevalence of major depression reaches up to 33% in patients with cancer, up to 29% in patients with hypertension, up to 27% in patients with diabetes, and up to 22% in patients with cardiac problems, compared to 10% in the general population. The burden of these disorders is enormous and includes emotional and economic struggles for both individuals and the community. Despite all these burdens, most developing countries devote less than 2% of their general health budget to mental health care. And although cost-effective treatments are available, 76% to 85% of individuals who suffer from severe mental disorders in developing countries have not received treatment in the last 12 months. The mental health field is subjected to neglect all over the world, and a negative stigma has always been associated with mental disorders, which creates obstacles to receiving treatment.
الفكرة إنه الطب النفسي إشي مخيف أو إنه الشخص إنه إذا بتعالج نفسيا إنه هذا مريض إنه ما لازم واحد يقرب منه إنه صعب التعامل معه.
لأن الناس بتعتبرها مريض النفسي وصمة عار على المجتمع وعلى العيلة، يعني ممكن أقرب الناس إليك ينفر منك، والراس هي مش عضو من الأعضاء، ولا احنا لغاية هون حبيبي وصاحبي وهون ما بعرفه. لا،
يظنون أنه عار ما تقولوا حتى لإخوته، ما تقولوا للناس، ما تقولوا للجيران، ما تقولوا للأقارب. هذا قالوا أنه مريض نفسي، ونسوا أن هذا المرض النفسي لا عار فيه. النفس يجب أن نعتز بوجودها وبعلاجها. أذكر حديث النبي صلى الله عليه وسلم يقول: إن لبدنك عليك حق، قال: وإن لنفسك عليك حق. إذن البدن والنفس شيء واحد.
بل العيب إني أخفي هذا المرض وألا أتعالج منه، أو المجتمع يمنعني أن أتعالج منه لأنه عنده نظرة العيب.
Various violations of human rights occur in most countries of the world, directed towards people with mental disorders, such as deprivation of food and water, deprivation of the right to marry or work, deprivation of treatment, or provision of compulsory treatment, in addition to physical restraint and seclusion in isolation rooms. The topic of human rights violations in the mental health field has started to gain much attention and interest worldwide. In Jordan, actions concerning this issue have started to take place. As Her Royal Highness Princess Muna Al Hussein asserted, as nations of this world, our duty is to carry human rights acts and actions to full implementation for people with mental disabilities. This is a lifelong journey that requires hard work, dedication, and ardent support and advocacy of all those involved. lawmakers, policymakers, and all stakeholders. We in Jordan are committed to improving the conditions for those people, recognizing that this will enhance development and prosperity. I am confident that we can all work together to take significant and necessary steps toward this end.